Over the coming weeks, the president has a full plate. His attention will be divided amongst the health care debate, the UN climate conference in Copenhagen, and his trip to Norway to accept the Nobel Peace Prize. To discuss this week's Washington headlines, we're joined by David Marks, senior editor from Politico. Hi, David. Good morning.
Hey, good morning. Good to be with you.
So we just heard Joel Brown reporting about abortions as part of the health care debate. There's also the public option. Those seem to be the two sticking points. What is the legislation in the Senate going to have to look like for it to get passed?
It's still really a moving target right now. These are two very difficult hurdles to overcome. The Senate Majority Leader, Harry Reid of Nevada, he's trying to negotiate behind closed doors to see if there's any room possible for compromise. He might actually end up reaching out to a couple of Republicans, Olympia Snowe and maybe Susan Collins from Maine, to try and pull them in if he can't convince his own Democratic colleagues to come on board.
We saw President Obama reaching out to the Democrats on Sunday. From your conversations with Washington insiders, how much of an effect do you think that pep talk had in getting the Democrats to sway with President Obama?
It probably stiffens the spines of those who already support him, but maybe were wavering a little bit. He probably didn't win over those couple of Democrats, say Ben Nelson, the Democratic moderate conservative senator from Nebraska, one or two others. But the others who he really needed to get on board and make sure they were with him, they did that. And maybe it got those Republicans to sit up and say, hey, we'll give this a look as well.
The senators have a new idea they've been talking about national nonprofit insurance plans. Explain to us how that would work and how easily you think that idea is going to pass.
This would essentially give people currently without health insurance coverage access to the same kind of health insurance program that all federal workers have, whether it's a U.S. senator or a postal worker. And it's a way, they say, to level the playing field, to give everybody access to the same kind of health care. For supporters of a robust public option, a government-backed program, this probably is not going to go nearly far enough. It's not clear at all that this would have majority support, but it may be one way to at least keep the process going past this, past something, then go into negotiations with the House of Representatives and rewrite the bill at that point.
David, let's turn now to the climate conference. The EPA is saying that something that I think many of us have had a hunch about already, that greenhouse gases are bad for your health, but now President Obama has that arsenal under his belt. What can he do, because I understand he can act without Congress, to change greenhouse gas emissions?
Absolutely. This gives the president the ability to go around the U.S. Senate, which would otherwise have had to ratify a treaty, and that would have been very difficult to get two-thirds majority support. This allows the president to, one, take action unilaterally and declare the changes in federal law. It also allows his team at Copenhagen to be able to say, listen, we're doing something on this. We don't even need to wait for the rest of the world. We're taking action on our own, hoping that spurs other countries onto action.
All right. David Marks, senior editor from Politico. David, thanks.
Thank you.